and I know of.
Yeah, well, Christian is not able to either. So, okay, so I'll just repeat. We're coming in June. I'll be there 2 weeks, starting June 2nd and leaving on the 17th. And Christian is going to come for a week sometime in that period. And we're going to be meeting a lot of different people, including the M Pharma, as a follow-up to your meeting, Abdul. We'll be meeting with some of the investors in M Pharma, and we'll be meeting with some of the Stanford people, Dr. Thomas. I don't know about Dr. Maxwell. We'll see. At least we'll reach out to him and others as we get closer. So, but between now and then, I'm hoping that we can start implementing the grant that we got from the church, the $5,000 grant. And that was what I sent out. And I wanted to go through that just to see if we're all on board to start moving forward, because Abdul, it'll be up to Abdul to then take it forward for us. So I wanted to start with project number 1, which is the Soccer 2000 Family Database Interview Information Capture, which is, Nancy, Abdul, Elliot, Aminata. Is that your full name? But it's Amina, who's doing the database. So, and thanks to Wycliffe, we have the database information template, which Amina, I know, has been working on and using their template with all their questions, but adding ours that she has been working with Elliot on updating that questionnaire to make sure it captures everything both the Ministry of Health want and we want. And so Amina, do you want to give us an update on that?
Yeah, sure. So I have been working on that database, and so far I've looked at what was sent over within those 4 databases, and I've been able to incorporate some of those fields in addition to some of the other information that we're looking for specifically from their families. So I've sent that over to Elliot for one last look to see what else needs to be added. And then from there, I can send it over to you all for any additional feedback.
Great. Thank you so much. That's a great start.
Can I mention that essentially she's doing a terrific job? It sounds like, did you take an all-nighter last night to get what you got to me this morning?
Oh, no. I was actually doing something else. So I wasn't able to get to it last night, but I then got to it this morning.
Oh, good.
Yeah.
Thank you. Well, you're right. You're right on schedule, because I had originally put completion date April 8th, which is today. So yeah. So you get the gold star. I mean, it's terrific.
But
it's so important for us. That's such a great achievement. Thank you.
I want to, sorry to interrupt.
Sure.
But I ended up and want to get your feedback and Abdul's as well, thinking that we should end up with 2 separate documents. One that would belong to WWK, and it would have the, players and the families and maybe 5,000 or 6,000 on that as a database that will only belong to WWK, because I think down the road, there's going to be groups that would want to access that database and maybe even willing to pay some things for it. And that would be, a big asset.
Fabulous.
And the second one would be the one that takes the basic information that we've already acquired and add in all the things that Wycliffe was looking for. And from what I can tell, I think what Amina has done to date is good enough to send to you all now. She and I spent a good deal of time on it going forth, with the idea that keep it basically confidential, not to give it out to other people. And then over the next week or 2, we'll come up with one that will go to Wycliffe and can become an overall one that can serve as a partnership document, the one that would be both for Whale and for the Ministry of Health. But what you need to know, at least in this first one, we even have a field for COVID. So it would say jab 1, jab 2, jab 3, none. And that starts becoming something when it gets to the Ministry of Health one. It can be a total document that goes for Kibera to show how many people have gotten their COVID shots and how many haven't. And we also have in there, and Aldo, you'll have to tell me, and Amin, if this is the right thing. we called it neighborhoods, and it would be 13 different neighborhoods. So it would be a document that people could look at and say, oh, this neighborhood is doing very well on the COVID thing, and it needs help in these other areas. And there's going to be a lot of things down the road that would be helpful. We also included a field for insurance where it would say NHIF or none, and we can modify some of them going forward. But I think it's really important that we'll know something about insurance, and we'll know something about COVID, even on the one that only belongs to Whale.
Oh, for sure. Yeah, that's a great idea. I love the idea of having two, one public, public information for Ministry of Health and one that for us. And we'll keep adding to it because we're not going to have, the 6,000 done immediately. It'll be done, I'm sure, in steps. So as we build on, and keeping it by neighborhood, I think is really important, because I believe that's how Abdul will be able to accomplish the first go through. Because as you know, or can imagine, the neighborhoods are enormous. And and my question for Abdul, now Abdul, for you, you're going to need to, and we had discussed this earlier, and I hope you've been thinking about it. You're going to ask each soccer league for the team members' information using the team template that Elliot and you have worked with. And now, once you get those templates back, information back from all these team leads, you're going to have to focus on maybe a couple of neighborhoods to start to test the interview and database questionnaire. So you're going to need some help, I think. But tell us what your thoughts are on this step.
Yeah, currently, you have said the neighborhood, we normally call them villages. We have like 13 different villages in Kibera.
Yes.
And the biggest village, I can say, is Makina village, is the biggest village where I'm staying and where most of our activities being conducted. So I think if you can divide the Makina village into either 6 segments, whereby at least you can assign individual into different small village, sub-village. We can assign them into from village to sub-village, whereby at least where they can get they can capture more information compared to maybe if you can just focus on one big village. So if you can assign different individuals to sub-villages, and if you can start with Makina because it's the biggest, it will be at least a good pilot project for a start. And assigning like the members, currently the members which I'm working with, the CHWs, majority of them capture the villages which I'm talking about. But the other villages we need, if time will come, we will need to recruit maybe 2 or 3 guys who are coming from other villages which we have not captured in our CHW members.
Okay, so let me just recap then. Spell the village that we'll start in to do the pilot?
I'm thinking about Makina Village.
Okay, spell that, M-A,
Makina.
okay, M-A-K-I-N-A. Good, that's where the
Yeah,
pilot.
yeah.
And now, how many sub-villages would there be in there?
Around like 6 or 8, something like that.
Okay,
Let's say
so,
8. Let's take like the highest number, the highest figure. Let's say it's 8.
great, okay.
Yeah.
So, do you have a way of engaging that group through either the league manager or the coaches or you to be able to find out where these people live? So you're not going to strangers, but you're going to actual soccer families, homes.
Yeah, because we have like the current registration form, which capture like the teams and also where they are coming from. It will be easy for let's say for CHW to know exactly where they are meeting. What I will do, because currently we are doing the registration for 2022 Soccer League. I'm supposed to have like a meeting with all the community coaches. That will be next week, so that we can kick off the league. So those are some of the information I will share with the community coaches about like what will be going on. And also I will invite the CHW also in that meeting so that I can introduce them to the community coaches, so that also they can be familiar with those community coaches. So when we are doing like the start, we will start with different categories. Let's say under 11, under 13, and under 17. Some teams we can, in our league, we have like some teams which register like all the categories. They have like from under 11 until under 17. So such a team, it will be easy for me to attach like the community coaches with that community CHW with that community coaches. At least he will be the one at least introducing each kid, each player for that community health worker, so that they can get information of those families.
Fabulous. That's
Yeah.
That's great to know. Can I just say,
Sure.
and I'm glad you're on, Amina, can you change, that 1 to villages
Yep.
and then have a separate field next to it that maybe we call it, you tell me, Abdul, you tell us, should we call it sub-village community?
Sub-village.
Just sub-village.
Yeah, sub-village.
Okay.
Just it will be under that Makina village. So at least we have like small sub-villages.
Do they all have names?
Yeah.
Yeah, we have names. Maybe later I will share with you, Amina, like the names of those sub-villages.
Yeah.
So that
Okay,
it will be very easy for community health worker at least to capture information or to capture data from different sub-villages.
Yes.
So that after capturing from sub-villages, now we'll do the total for the entire Makina village. We know now we have captured the entire Makina village with the information or the data which we are looking for.
Okay.
About how many members would that be? How many players, families?
In one team, according to our registration form, one team is supposed to have like 15 players.
And then how many teams are in those sub-villages? Is it each sub-village has one team?
No, sub-village can have even 3 or 4 teams.
They have what?
3 or 4 teams from different sub-villages. And sub-villages can have 1 category or maybe 3 categories, or some villages will have like 3 different teams having like 4 different categories.
Okay, good.
Yeah.
Okay, so we'll just have to keep track, and that's excellent. And you're
Just so
saying,
you know, Amina's done a terrific job. She knows how to really manipulate databases. That
Good.
on each one of them, there's an ability to click something that will drop down a thing that might have, I guess you could have as many as 8 or 10 names that would be the actual names of the sub-village. So
Right.
on that second field, we can divide them that way. And the other big thing going forward, which Ministry of Health didn't have, but we're moving ahead, is to put in the date of birth, because then down the road, we could look at a sub-village and divide it by those who are 1 year old, 2 years old, 3 years old, and find out whether they actually can get the immunizations that they need that are the well baby care. And we can do all kinds of things having such a good database.
Yep.
So that is really important information, Elliot. That's great. So Abdul, you're going to have to figure out how the CHWs can connect with the families to know where they live to gather the information.
And also, I have like one request.
Yes.
For us to get good information from the community coaches, for them to come for us with that information. If we could have for instance, if we have like 4 categories from one team, so after them giving us all of those information which we need, if we can boost them by giving them one soccer ball, so many teams will come for that information. They will come giving us those more information. So those are some of the things.
Oh, sure.
If it will be possible, if it will be possible for us at least to boost them.
Yeah,
So it's just a matter of, if you give us all this information, we are giving you one soccer ball. If you give us all this information, we're giving you one soccer ball. If you can have that as a boost for the community team, they will come running.
Yeah, good.
They will come running for that information.
No, that's a done deal. The grant is to support getting this information. So absolutely. So you just keep us informed what we're going to be spending the money on. That's perfect. And we're also going to pay the CHWs. So you're going to have to figure out how long is it going to take to fill out. That's why you want to be very close to the first questionnaires, being you have to walk with them. How long will it take to start and finish this questionnaire without rushing through? And are the CHWs trained enough to know how to approach the family, ask the questions, or should there be a training? And the training could be by you or Wycliffe or Anne. So one of the people.
I think as long if we will finalize with the spreadsheet for the data information, that will be, at least we'll know exactly what information are they going to ask from those families. And we will assign, apart from like the CHW going by herself or himself to the family, he will be accompanied with that community coaches, because that community coaches is well known by that parent than CHW. So whenever they will be meeting different families, they will be accompanied with the community coaches in different households. So what we will do, as long we will just share the information with the CHW, what they are supposed to capture, then we'll invite the community coaches to share with them, like, this is the data we are looking for, and these are the information. Whenever you'll go with this community health worker to different households, these are the information you need also to share. So prior to visit to those families, that community coaches, he's supposed to share that information with the players, to tell the players that, to share with their parents, we'll be visiting them this and this and this time, or we'll write a consent letter to the community players, whereby we'll give the coach to give to each parent. So whenever we'll be visiting those parents, they will know exactly this is the information we were told by our player or our kid through their coach, that these guys will be visiting us and they'll be needing this kind of information.
Abdul, I don't think we want to give them the whole questionnaire, but could you write them a note sort of introducing the project? And
Yeah,
I think
I
that's
will do that.
from
Yeah,
you,
that
it would be
on my
very
side.
important. And tell
Yeah.
them, part of the thing, and everybody can, chip in here with the ideas, that this is to help the community health services, to improve the community health services.
Yeah, that will be coming from my side.
Okay, yeah, come
Yeah.
up with something that makes it, because it's to help the
Yeah.
community, and it's coming from you and the soccer leagues, and so it's not coming from somebody outside, or even
Yeah.
from the community of health, the Ministry of Health. It's coming from, whale, the
Yeah, I will
soccer
tell them
league.
that. Yeah, that is the YYO project.
Yes,
And they will understand that. Yeah.
yes. So if you could do
Can
that,
I just go back a step? Because like in 2 weeks, today we'll be able to send you all the database that's just going to be for the, let's say, 2,000 players and their families. But in 2 weeks, we'd have a broader one that could go out to the whole community. And what I'm wondering, Abdul, is it's a spreadsheet. It's a form of an Excel spreadsheet that you could get the one, and Amina, you jump in on this, that maybe if you have the ability to go with community health workers and coaches, they could fill it out on the spot.
Mhm.
Yeah, it will be. Yeah, it will be easy, because the advantage which we have currently, the organization is well known by the community coaches and the community players. So convincing their parents, it will not be easy. It will be very easy. So even if I will go to I'll go to different families with community coaches and community health worker, they will still cooperate and they will still give us the information which we'll have. So what the most important thing, because I know the situation on the ground with the community club or soccer teams, they are lacking equipment. And the overall thing is the soccer ball, which at least will unite them and bring them together. So if we have something, it will be take and give and take, whereby at least we give them the soccer ball and they give us the information which we need. So at least both parties will have benefited from the project.
yes, and in your introduction letter or note, however you're going to let people know, make sure you mention that. The other thing is, you're not going to leave the questionnaire with the family. They're going to be filled out by the CHW and the neighborhood, who was it, community coach, one-on-one. So if you can do it electronically, as I think Elliot was alluding to, on the phone, if some of you have a smartphone, Wycliffe said he had an app that could go on your phone, and you could just input the information as you're speaking with the family, rather than writing everything down on a spreadsheet.
Right. And just to add to that, I guess just thinking more about the logistics of how this would work. So I would need to share this sheet, I guess, with Abdul or whoever it is that will be collecting this information. But I just want to make sure that we're not sharing it with too many people, if that makes sense. Because then that then gets a little tricky, especially if we want to make sure that this is secure.
Yes.
So, I don't know if maybe there's a main iPad or something that's being used that we that is the tool that's being used to collect the information, or like you said, Nancy.
Yes.
Yeah, that's kind of what I'm thinking.
Yeah, it has to be private, because it can't just be lost on the street, with somebody's name on and all their information.
Yeah.
So if it's on an electronic device,
Mhm.
it's going to be safer.
Yeah.
And we've got to, down the road, we're going to add, sort of sub tabs, because like Wycliffe talked about, tuberculosis, TB, and maybe cancer and maybe other kinds of things. Then it becomes real important to make sure that the data is kept secure and not available to everybody.
Abdul, can you check with Wycliffe and see if he has any iPads or phones that you could use to get this data?
Yeah, I will inquire from him. But what I'm
Because,
thinking about,
yes,
what I'm thinking is that the way you guys have just said, it's supposed to be very private and also confidential. Whenever maybe the CHW and the community coaches are going to the different household or meeting with the different families, the information maybe I will be giving like the community health worker, like I will assign them, let's say like 5 sheet which will cover like for this kind of family. So whenever she or he will bring back, I will know that exactly I gave them 5 and they returned the 5. So no information will be given to the CHW or no data information will be left with the CHW or the community coaches or the parent. So all the information after going to the field, when they're coming back, they will bring the information to me, then I'll just file them.
yeah, and just, and double check with Wycliffe, because I'm sure they have a lot of experience gathering this type of information in one way or the other, and see if he can't help you, because it's important data and we don't want it to get lost or people feel like their private information was not used correctly. It could be very bad for us if whale slips up on something, even if you don't do it intentionally. So just go through the process with Wycliffe and just get his like, yep, that's the best way you can do it. Or here, I have some extra phones or iPads to gather the information. Just run it by him just to make sure. I don't want you to get in trouble or whale to get into trouble.
Yeah.
Did the community health workers have iPads?
No, probably.
No, they don't have like iPads. So what they have like their own, like some have smartphones, some don't have, some have like the analog phones. So they are not equipped with the gadget which will capture the information which we are looking for.
No, so ask Wycliffe if there are tools you could borrow from him.
Also, I have
Yeah, I will ask him. Yeah.
I'm sorry.
I have a question for
Christian, hi.
I've been listening to her. I don't want to interrupt Abdul or Mr. Elliott. So I have a question for Abdul. I want to know if Abdul can tell us out of the 2,000 soccer family, how many families do we have exactly out of those 2,000 soccer players? Are they coming from, does he know the number of the family they are coming from? That's what Abdul. Can you go through your record and figure out of those 2,000 players, how many family are they coming from?
So the 2,000 players, they are coming from different like numbers of numbers of family. Let's say, I'm not sure exactly, but I can do that research very, very fast. Then I give you the information, because like the registration, those are the registration number of players. But how many families are we targeting? If you can give me like only like today or tomorrow, I'll just give you like exactly. We'll be targeting this number of families from these 2,000 players.
Yes,
Yeah, that's important. Good information.
I'm going to tell you why I'm asking information, because it will be important for us to know that number so that it could help us to determine the number of CHW we can hire to do the job, because to get that master database we all need. So that, because if we don't have enough CHW, it will be hard for us to get all the data that we need. That's one. And second, I listened to what Mr. Elliott was saying. The more data we have, the more accurate data we have, the more what we can do going forward. When it comes to the type of immunization we can offer to that community, the number of children age 1 to 2, number of children age 2 to 5, they all have different schedule for immunization. So it's important for us to know, to have the number of families that you have in that soccer tournament, and then we can determine the number of CHW we may hire to do the job, so that we can get the accurate data that we need to do the job going forward.
Well, I think the
Sure.
first go through is to figure that out, Christian, because none of us have seen a database questionnaire. So it's hard to know how long it's going to take a CHW with the community person to fill it out per family. So that's one of the things that has to be tracked, Abdul, is when you first start going out, time it. Have people time it from the minute that they reach the family, find the family's home, to the minute that they finish. Does it take 30 minutes? Does it take 15 minutes? Does it take 60 minutes? And the time in between the families, it has to all be tracked, so we know how many people we need to hire and how long it's going to take based on how many we're going to get.
Exactly. And also, I strongly believe that all CHW must go through kind of training, so that we can convey to everybody the same information that we need when they go on the ground to get the data. They all
Yes,
have to go through a training.
Yes.
Training. I strongly believe that. So that they don't go over there and they do the they have to go at least to 1 day or 2 day training, or 1 3 hours or 4 hours training, but they almost go through a training. So that
Yes.
we know that by going down on the ground, they know what to do, they know what to collect.
And I had mentioned that earlier, that Wycliffe offered to do a training. So Abdul, Christian's absolutely right, because I would expect that none of the CHWs have ever done this type of work. They might not even be familiar with some of the terms on the database questionnaire. So you don't want them to go out there not feeling prepared and confident. So again, ask Wycliffe about a training for the CHWs who you're going to select to do this. Yeah,
That would be
otherwise,
fine. At
the
least,
questionnaires
yeah.
is not going to be valid. It's going to end up being sloppy, and it's not going to be worth anything. That's the problem.
Yeah, we'll need like a training. The way Christian have saying, that's a good information, because we need all of them to be doing like a uniform thing.
Yes.
So I will
yes.
talk with I will talk with Wycliffe. If you can organize like a 1 day or some hours the way have been suggested, then I will let you know his availability or maybe his commitment for that training.
Yes, and then of course we're going to pay the CHWs, including for the training. So, just map out how, the steps that we have to take to get this done. Go over it with Weekly, and then, come up with a budget. We have the money. It's just that the most important thing is done correctly. Otherwise, it's not worth doing it at all.
Abdul, how many coaches do you have overall, and how sophisticated are they? Are some of them able to actually double in helping put together the database?
It will depend with my meeting with them, when I'll be meeting with them. But some of them, I have like even some informal school teachers who are also volunteering with community, having like a community coach. That's a passion for them. Apart from them going to school or maybe teaching, they have also their community soccer team. So they are the one managing. So we have like individuals who can do that job also, but also we need to select who will be the right person, at least for that assignment or for that task. We have like individuals who are very, very good.
How many coaches do you have overall?
The number of coaches, unless if I just check on my data, then I will just check to exactly how many coaches we have. But we have like the 2021 we have like around 50 to 60 coaches. But
Oh, that's good.
some of them some of them have like one coach can have like all the categories, and some have only one category. So it depends with the coaches, but the total number they are fluctuating around like something to do with 40 to 60 coaches there.
Oh, so that's a really good number to know. And one of the things, it's good that Christian's on the call. He and I are going to have another session later today. One of the things that we want to talk about, I don't want to get off the database too much, was to think about putting together like 3 health fairs that would include, sort of a soccer festival, and try to get sponsors who would pay for advertising for the health fairs and all. And that's where the coaches could really come into some of it and could potentially get paid some as well.
That's a
That could be
great
like
idea. And that we can do that probably in June. We can actually implement it maybe by June, by the time we're there. Because
That might be one of them, but one of the things Christian and I, Nancy and Abdul, are putting together a series of assignments that he's going to get himself overloaded when he comes. And you all should figure out what you want to do together with him. And then he's going to go off on his own and has a whole agenda of things. And one of them is that health fair stuff.
great. So we can help plan with them ahead of time. So when we get there, he can hit the road running and meet people. We could set up the meetings ahead of time, because there's a lot of opportunity in that area. I mean, there's so many different groups we can approach that we all of us know, different groups. So once you start working up that plan, share it with Abdul and I especially. I mean, you can share it with everybody, but then we can start thinking about who we want to contact to meet, or, send the idea, that plan ahead, proposal ahead. So when we get there, we can actually meet the people and go through the plan, or actually have it. It'd be great if we can implement it when we're there. I don't know if that's possible. I'm just talking out loud, because
It's hard to know. We'll talk about it some and figure out whether, there could be a small sort of pilot one when you guys get there in June, but then plan for more formal ones after that.
that's a good idea, because on the ground is so important to try these things out, as we found. Things that you never think of pop up and you go, oh my God, there's no electricity. Okay, so yeah, that'd be great. That would be great if we could do a small pilot when we're there, and we can plan it together before we get there, and then see how it goes.
I think that might work.
Yes,
Christian.
I'm finalizing a draft about what I hope to accomplish. I'm going to share with you guys sometimes by the end of this week to Nancy and Mr. Elliott. So I'm still working on it, on the details. I'm almost at the end. I'm going to send you an email. I'm going to include also Abdul in that email. I'm going to show you my draft so we can talk about it. I'll be more detailed about what I want to accomplish. I'm a pharmacist. You guys all know that I'm more of a clinical person. So I will hope to go down there to help, because if I don't see no need for me to go down there, I would better stay here and help my patients. So I'm going down there to be more of a hands-on person help, because that's what I do every day. I have at least 20 years experience working in the pharmacy industry here in the States. So I'm going down there. I want to help. Otherwise,
Great.
there's no need for me to go there. So,
Great.
that will reflect on my draft that I'm going to show you guys. I'm going to send you guys by the end of this week. So
Okay,
we'll see what I
great.
want.
Yeah. And so Abdul, because we're getting to the end and I'm gonna have to leave exactly at 9. So you're gonna check with Wycliffe on everything we talked about for the database. Amina is gonna share the database with all of us. And Abdul, you can share the one for the Ministry of Health, but not the personal one for us with him. So make sure you mark those clearly, Amina, for WWK only. And then the other is for the Ministry of Health. How's that?
Yeah,
So then there's no question that the Ministry of Health gets to see the Ministry of Health one. And then WWK is our personal one. And then Christian's going to send us what his ideas are. Okay, is there anything else? That's pretty good.
If you've got to run in like 8 or 9 minutes, I'll give you 2 1-minute things. Bill Bentley has been working and we're setting up a session with a woman who is in charge of the UPS delivery program for East Africa.
Fabulous.
And we're talking to her about maybe paying for the delivery of these gear that we're collecting. And you've given us some ideas, Abdul, like the soccer ball and all. I got a commitment from the people who were out there getting the duffel bags. And he promised me that by June, when at least Christian's going to go off from around here in Washington, that we'll have 3 duffel bags that he can take over.
Fabulous.
I haven't told you that, Christian, but you can figure out if it's extra baggage, we'll have to pay for it. But
yeah, it's easy. Christian, don't worry. Just tell them it's a nonprofit. They'll let you take
but
it.
anyway, it's 3 duffel bags, Abdul, but balls take up a lot of space. Is it cheaper for you to just buy some soccer balls over there?
Why don't you deflate them? I deflate mine.
Yeah, no, he does that, but it's, well, whatever. We'll figure that out.
You can get quite a few in that duffel bag if they're deflated.
Yep. But anyway, that's one of the items. And then as part of it, Jennifer's been working with the Montgomery County and they've given us a commitment. I have another meeting with them next week with Jennifer about maybe putting out something like 10 or 15 boxes around in their rec centers to collect even more gear and to collect some used phones and whatever, iPads or whatever, because we've now got a group that knows how to take the pieces of them and potentially sell them. And when they sell them, we're going to get a portion of the proceeds and we can use that as funds to pay for shipping and other things.
Oh, fabulous. Abdul, you're on mute.
Yeah,
Yeah.
yeah, that's fabulous, Professor, and that's a positive move now. At least that if that will happen, it will create like a very big milestone to the organization. Congratulations for that, Mr. Professor.
Yes.
We're not ready for congratulations yet. We got to pull this off first, but we'll get there.
That's congratulations for that process you have made. At least you have made a
Yes,
milestone. Yeah.
Fabulous. Fabulous.
Yeah.
So
Getting that information also is like a plus for us.
oh, it should be great. Abdul, this summer is going to be a turning point for the organization. So we're really excited. And it's all because of your leadership. And without you, we could never do this. So, you know, pat on your back.
Yeah, thank you so much. And also you are my mentor. I'm just dedicating my time and everything for my community. And also you are the one at least making me feel like everything will be possible, or maybe my dream will come true soon. So thank you so much for everybody who are making this at least to happen. We still have like a long journey, but one day, one time we'll make it.
Yeah, one step at a time. I have a question for you,
Sure.
Abdul. You're going to meet
Sure.
with Henry, the CEO there in Kenya for M-Pharma.
Yeah.
Would you ask him if he would be willing to, and this is something I'd talk to Christian to see if we could, if we found like maybe one in every village, a really good pharmacy, would he be willing to give them the Muti cards to give out to their customers?
Yeah, I will share that because I'm supposed to meet with him on Monday at around like 11.
Good.
So I'll try to share that information with him. And also maybe when Nancy and Christian will also come, at least we'll try to also to push that information also when we'll be meeting him again.
Yes.
Yeah.
Yes.
Yeah.
Yes.
Well, we're going to have 3 or 4 initiatives to talk to him about, which could become a big, big program for Wayo in a partnership with M-Pharma.
Yeah.
Excellent. Excellent. So anything else, anybody? Thank you, Amina, for your database work. It's much appreciated.
No problem.
Yeah.
Wait till you see it. You'll be really impressed.
Oh, I can't wait.
Yeah.
Yeah, we'll all be looking for it. So that's great. Great work, team. So next week, you're going to have a meeting, Elliot, on Wednesday?
Yeah, I guess so. Next week's a tough week for me, but we'll do the Wednesday one for sure.
Yeah, include Abdul because he'll have met with Henry and we'll have the database and myself. So
Yeah, Simi sets them up for Wednesday, but I'll tell her to include it.
yeah, that's an important day. It doesn't have to be long, but there'll be a lot of good updates. Okay.
If you're getting off, can we still talk a little bit? Because I wanted to mention the thing.
Yeah. No, go ahead, because I'm just gonna have to leave. So I'll leave it on.
Okay, good. So,
Yeah, I'll just leave it on.
okay, Amina, I have a question for you. Are you able, do you think by next Wednesday and all, you could do at least a draft of the one that we can send to Wycliffe?
Yes, I think I should be able to have a draft by then.
Okay, and well, you've got a couple of the variations that we talked about today, which I think that was good to have this village thing, and I don't know, I'm going to go over it again pretty carefully, but I'll just send you any other additions, suggestions that I have. But if we have it, you know what Wycliffe has, and instead of that, age, putting in obviously date of birth.
Right, yeah. Okay.
All right, do you have any other questions while you're on? And Christian might have some suggestions. What I'm thinking is at some point that we will have a separate database that will be just related to the pharmaceutical and Muti program. So we would have a whole group of people from the 2000 and their family on Muti, and then see who else we can add to it. But that would be, additional one, and hopefully we could get thousands of people to join.
Yeah. That sounds good. I did have one question about the database. So currently I have on here county and sub-county. Is that, Abdul, is that something that I need to keep on the the way of mail one, or what are your thoughts?
About like the county staff.
Yeah, should I just leave, should I just have villages and sub-villages, or do I need to include county and
No,
sub?
you just have like villages and sub-villages, because like whenever we'll be going to the next village, at least I will be sharing with you sub-villages. So I will share with you like all the 11 villages, or maybe if you have like all the 13 villages with you, it's okay. If you need like, I can share with you like all the 13 villages which are in Kibera, I will share with you. And also whenever we'll be going to villages, so I will be giving you also information about the sub-villages in that villages.
Okay, okay, great. Yeah, if you
Yeah,
can,
that'll be good.
yeah, if you can send me that, so
So
I
should,
can keep it.
so should I send for you like the names of the villages which are in
Yes,
Kibera?
yes,
Okay, I
please.
will.
Yes.
Okay, I will.
And then
Okay.
once you do that, I can share it with everyone. Or Elliot, would you prefer me to go ahead and send it now, or what would you like me to do? Wait until I
But
get.
we know that we'll have it. So if
Okay.
you get it now, fine. But if not, I think it's more important to just get what you have out there and get some reactions. And you can do the drop down of the names of them later.
Yeah, okay. All righty, so I'll go ahead and send that then.
Okay, and so while Christian and Abdul are both on here, I had a thought, which is what I was suggesting maybe you ask Henry. Abdul, does it make any sense if we went, and especially when Christian gets there, to go around, let's say, to the dozen or so villages and find the best pharmacy in each one of those places and say, would you like to become part of the network of WWK and M Pharma? And we'll try to get you more patients, and your people could join this MUDI and get a drug discount. Is that asking, is it possible to go find 12 in each, one in each village, a really good pharmacy?
Yeah, I will try to ask Henry. Then maybe the suggestion, or maybe the input he will share with me. I'll make sure that at least I will share with you. So I will try to make him to ask for that information. And also my request for him also, I want him also for me to work with him in those like villages in Kibera, so that he can see by himself. Maybe whenever he is, maybe he doesn't know like exactly how Kibera is. Maybe he just know like the name slum, or maybe informal settlement in Kibera. But if I will work with him, maybe it can give him like sense of maybe direction, of sense of maybe deciding that is the community maybe they are looking for. For information, maybe he just know like Kibera is just like an informal settlement where there is a lot of chaos or maybe fracas. But whenever he will walk around, at least it will bring a very different picture to him. Yeah.
I think it'd be terrific for you to take him around and let him get a good fix in his mind about, the whole area.
Yeah.
So while I'm thinking about it, because I keep coming up with other things to maybe try, maybe too much to do more than one big question, which I put to you to ask him. But what happened here in the United States, and Christian, you can tell me how extensive it is going on now, is that some of these pharmaceutical benefit companies, which is what M Pharma is, would give a card to people and say, you belong to the MUDI program. And what we would maybe be able to do, if he agreed, is that you could give out these cards. So they would be WAO dash Muti on a program. And we'll see you later, Amina. Thanks for joining. That it would be a card that would say Wayo-Wayo-Muti. And when anybody filled a prescription, they went and got a prescription for whatever, diabetes or something, it would get filled and the database would then say, oh, this is a Wayo-Wayo person that got on. And then they would send Wayo-Wayo a small amount of money, like maybe 25 cents for every one of these that got filled. And I don't know if that's the program that was the model in the United States that MFARMA is copying. And I don't know if they're getting to do that or not. Christian, you still on? Are they doing that around like that Good RX does that, right?
There is something I wanted to talk to you later today when we meet on the phone.
Okay.
We have to do with MFARMA. I want to say that city right now because I wanted to ask for your advice first before I can pay it out. Something we can use as an add value when we talk to MFARMA to get some kind of leverage with them. So I'm going to talk to you about it later today when we talk on the phone.
Okay, great. So Abdul, if you just can find out whether they, the first question I asked about, getting good pharmacies in each of the villages.
Yeah, I'll make sure that at least I will ask Henry about that. Then
Yeah.
I will let you. I'll just give you like the feedback what maybe he will have suggested.
Okay, great.
Yeah.
Do you have any other questions for us while we're still on? I think we've covered enough things to put you onto overload.
Yeah, currently at least we are doing very well, I can say, because in terms of like health sector, at least we have captured something, and we are taking like a good milestone, and also in the soccer program also the same. So far so good, according to like the information which I got from the team, and I hope maybe as we are registering now another team for 2022 soccer league, maybe something will pop up from there. But currently, at least the information which you gave me and also the assignment which at least you left me with, I will just do the assignment and keep you updated about that.
Yeah, no, that's great. I have in the back of my mind that I know you'd like to set up a nice academy and maybe someday have a professional team, but we're not quite ready to do that yet, but might be able to get there.
And that is my dream, Professor, to have like a good academy then connected to maybe to Europe or maybe somewhere, so that at least you can change lives of the current player which are here in our community who are so talented, but they lack like opportunity. As we normally know, talent is universal, but opportunity is not. So getting that opportunity for those players at least to excel in terms of their soccer skills, those are some of my dreams. And also I was thinking about if I can get like a course whereby at least for like agent course, or maybe recruitment, recruiting like let's say like what do you call them? We call them agents, or so those who at least select like the best individual, the best skill, talent individual, then attach them to the professional academies abroad. So if you can get like such like kind of training, also I would really appreciate at least to take one. But all in all, at least I want to change the life of my community through soccer, because those are I got so many opportunities through soccer. And also I just want to give back to my community also, to know that soccer also is something which can make you prosper in life.
Yeah, no, I know that. I know that well. That's what we've gotten a lot of people to get involved in the soccer program and then have become ones who go on to college, and some of them go on and become professionals. Not that many, but enough of them to make it worthwhile.
Yeah, just a matter of that changing life. Those are the main objective.
So, well, we'll keep at it. I'm going to always in the back of my mind look for some opportunities like that, either some in Europe or maybe some in the United States. But you think you could find good enough players so that Kenya could make the World Cup to come to the United States in 4 years?
Yeah, we just cross our fingers, like our system to be in order. As you know very well now, we are banned by FIFA because of a lot of like appropriation of fund or misappropriation of like program. There's no transparency. So at least currently we are banned from any international